Hello everyone, my name is Aditya Kadamanchi and I'm from the University of California, San Francisco. Today I'm going to be talking about developing a research question, and this is part 1. The concepts underlying a good research question are the same, regardless of whether or not you're talking about a molecular mechanism of action, or, in the context of a programmatic study, how do you implement or put forth an intervention in a programmatic context. However, in MECOR, the universe of areas and the associated methods are largely what's listed on this slide. So your research question should really address one of these areas and use appropriate methods for that area. It's also important to point out that these areas are overlapping. So for example, if you want to address a health policy question, it's important to know the disease burden, to know sort of what are some of the clinical options for management, to know the social determinants of health, and to understand sort of what services there are in the health system to help manage this condition, and what are the costs of the different options. So in some ways, all of these areas are related, but your question should hone in on sort of one particular area. This slide depicts a cartoon and a quote from Alice in Wonderland, which is a novel written in the mid-1800s by Lewis Carroll. In it, Alice sort of drops through a rabbit hole into a fantasy land, and she encounters a Cheshire cat, and she asks, "Would you tell me, please, which way I ought to go from here?" And the cat responds, "That depends a good deal on where you want to get to." The same is true for your research question. Right? The real question is, what is the outcome you're interested in? And once you understand that, you're going to work backwards to figure out what are the steps necessary to get there. Good research questions come from many different sources, but in particular, they arise from recognizing a problem or making an observation during your everyday work, whether it's in a clinical or a public health context. So for example, you might find that there's a discrepancy between actual and desired results obtained from a programmatic intervention. Or you might find that disease incidence is higher in one population or in one region than in another. These then become sort of areas for further investigation. And your research questions might focus either on why questions. So for example, what's the cause of the problem? Right? Why is this happening? Or they might be how questions. Right? How do you develop a solution to address the problem that you're encountering? This slide shows examples of both observations and identified problems leading to research questions. So a problem leading to a research question, for example, might be low coverage of services for prevention and treatment in certain geographic areas, or frequent drug stockouts in peripheral clinics. Both of these problems can lead to research questions about why these are happening, or what can be done to address these problems, or how they can be addressed. Some observations that might lead to a research question: disparities in COPD prevalence and incidence, increases in TB incidence for certain groups, right? So you might ask, why is TB incidence different in these groups? Or what can be done to reduce TB incidence in these groups? In other words, how can TB incidence be reduced in one group where incidence is higher? Generally, the first step is why. However, there may be sufficient information available that the why can be assumed and the how question can be addressed. For example, we've observed that treatment completion rates are low among patients living in region X. This is a why question. But if you have sufficient information, or you've already done work to gather data to inform why this might be the case, then you might be able to ask a question about addressing potential solutions. For example, you might ask, will locating a satellite clinic in region X improve rates of treatment completion? So this is an example of sort of a how question. Before you even formulate a research question, you first need to ask yourself a couple questions. Is the problem that you're facing, or is the observation that you're making, does it even need to be researched? Right? Is it a problem that needs to be solved? Is there a need to look into this observation further? Right? Is the answer self-evident, so it doesn't really need to be researched? Or have other people already looked at it? Right? It's really important to do a literature search, talk to colleagues, right? Talk to experts in the area to figure out whether or not there's already an answer to the problem or to the observation that you're making. The second thing you have to ask yourself is, do you have the resources to carry out a research on this problem or this observation? Do you have enough time, money, and qualified research staff, the right methods, training in the right methods to do this research appropriately? So at this point, we've discussed the general concepts involved in coming up with a research question. In the next part, we'll move to a discussion of how we refine the original question and get to a question that's feasible to address. How do we add the necessary specificity in order to carry out the research?